Good morning, everyone. I'm Dr. Minnu RAJU, and I'm presenting a case of myopic strabismus fixus, which was managed with loop myopexy using a non-absorbable suture. Myopic strabismus fixus is a complex strabismus which is associated with high myopia, and there is a supratemporal globe elongation in this case, which causes a nasal shift of the superior rectus and inferior shift of the lateral rectus, which causes esotropia and hypotropia, and oculomotility restriction in abduction and supraduction. A newer technique of management of myopic strabismus fixus is loop myopexy, where the deviated superior rectus and lateral rectus is brought back together to their normal anatomical path. Different modifications has been described, like the Yokoyama procedure, where a full loop myopexy of the superior rectus and lateral rectus with a polyester suture is done as shown in the picture. Next is the partial Jensen procedure, where the muscles are splitted up to the post-equator region and apposition of adjacent halves is done. Yamada procedure, where there is hemitransposition of the superior rectus and lateral rectus with combined large medial rectus recession. The last one is the modification with silicone band, where full loop myopexy of superior rectus and lateral rectus with silicone band is done. I'm taking you through a case of a 5-year-old male who has presented with right eye being stuck down and in for 2.5 years. He is using high myopic glasses and is a diagnosed case of chromosome 9 inversion and duplication with facial dysmorphism and intellectual disability. The family album tomogram showed the progressive esotropia and hypotropia. Imaging was done and MRI showed inferior shift of the lateral rectus and nasal shift of the superior rectus. The patient had subnormal vision in both eyes. Examination under anesthesia revealed a high myopic refraction, high axial length, anterior segment normal, posterior segment with myopic fundus. On-table force reduction revealed a tight medial rectus. Hence, right eye medial rectus recession of 5 mm with loop myopexy of superior rectus and lateral rectus with non-absorbable suture was planned. This is the surgical video where the lateral rectus was found displaced and which is hooked. Superior rectus was also hooked and separated. Globe is inferiorly displaced. 15 mm was marked. Non-absorbable dacron suture was passed through the superior half of lateral rectus and the temporal half of the superior rectus, and then they were looped together. However, post-operatively, we were on surprise because patient had an exotropia. We went back and did a right eye medial rectus advancement back to the original position. Take-home messages is that when we are dealing with a case of complex strabismus, we have to take a detailed history from the parents, review the family album tomogram, imaging for the muscle position, and be prepared for operation table surprises and modulate the plan accordingly. And we do prefer a stage surgery for such cases. Thank you.
What is the percentage of this kind of a syndrome in children? High myopia with a prolapse.
I'm not sure, ma'am. The percentage.
It's very less.
Less, yes.
Dr. Minnu, did you take a family history of high myopia or strabismus in the family, strabismus fixus in the family?
The mother was a myopic patient, but not high myopia, ma'am.
How much was the deviation?
The deviation was actually not reliable because the patient was a intellectually disabled child.
Okay. So rough idea what you have done to check how much is the deviation?
It was fixed in isotropic.
Okay. Harshpur?
The eye was fixed in isotropic. Yeah.
Okay. Not ever say that you cannot measure. You always need to measure. There is nothing you cannot say that you cannot measure. In children it is difficult, but you have to measure. And then in your case, the patient had high myopia as well. So you have to
like see the values, how much exactly you are expecting and how much it is visible. Like there are the myopia charts for the correction. Okay, so maybe it was little higher correction was done. That's why it went to exo. So we have to check this. Okay, thank you.